So syncope is a sudden and transient loss of consciousness. It's generally very rapid in onset. It lasts for a very short duration, and it is very characteristic that the patient recovers completely and spontaneously from this transient loss of consciousness. And it usually occurs because there is decreased blood flow to the brain, and this can be due to multiple reasons. It could be due to traumatic reasons or non-traumatic reasons. The non-traumatic reasons are generally related to cardiac conditions, amongst many other reasons. Cardiac syncope usually is due to structural defects within the heart or structural abnormalities within the heart, or it could be related due to rhythm problems of the heart, either a very slow heart rate or indeed a very fast heart rate. It could also be due to other reasons, like suddenly a patient having a myocardial infarction can lose consciousness. Tumors within the heart can also cause cardiac syncope. So if you were to talk about cardiac syncope, one of the commonest reasons for cardiac syncope, wherein a patient could lose consciousness, just as we said, is because of valve abnormalities within the heart. The most common being aortic stenosis. So we have 4 valves within the heart, and one of them is known as the aortic valve. When the aortic valve is very severely narrowed, the patient may have sudden decreased blood flow to the brain, leading or resulting in a loss of consciousness. Equally so, they could also have either a very fast heart rate or a very slow heart rate, which could culminate in syncope. So when you do present with syncope, usually you will have a full general physical examination, and your doctor may pick up a murmur, that is on clinical examination, and when they investigate it, you're likely to have an ECG in the first place, which would tell us if there is any rhythm problem with the heart, be it a very fast or a very slow heart rate, which could have potentially been the cause of syncope. Further investigations are determined by what your findings are on clinical examination. So you may well go on to have a chest x-ray, and you're quite likely to have what is called an echocardiogram, which is just a scan of your heart by putting some jelly on your chest and studying your heart function and the valves within your heart. That would confirm the diagnosis of a narrowing in your aortic valve, which generally is supplementary to a clinical diagnosis that is made. Your physician or your cardiologist then may advise you to have further investigations like a coronary angiogram to make sure that there are no other problems within your heart or your coronary arteries, so that once all the investigations are done, you would then be referred to a heart surgeon for further treatment. There are a couple of different ways of treating aortic stenosis in this day and age, because several advances have been made in the surgical field and innovation. But typically, if you have a severe narrowing of your aortic valve, which is again decided based on your symptoms and the findings of the scan of your heart, which is the echocardiogram, which would give us the severity of the narrowing of the valve. It would tell us about how your heart is functioning at that point in time and how you're compensating or not compensating for the narrowing in the valve. So if you do have symptomatic severe narrowing of your heart valve, then one would advise typically for you to have open heart surgery, and that open heart surgery is called an aortic valve replacement. In a different group of patients in whom the risks are extremely high and the comorbidities are such that they may not pull through open heart surgery, there are newer ways of dealing with this, and that particular innovation is called TAVI, and TAVI stands for transcutaneous aortic valve insertion. That is not open heart surgery, and that involves a valve being delivered inside your native valve to open it up thereby relieving the narrowing of your existing valve and improving your symptoms.